Cervical cancer arises from abnormal cell growth on the cervix, the lower part of the uterus that connects to the vagina, and can lead to serious health complications. Most cases are symptomless in early stages, but as the disease progresses, individuals may experience irregular bleeding, pelvic pain, and pain during intercourse. Advanced stages might also present with weight loss, fatigue, and a loss of appetite. Treatment options vary based on the stage of the cancer and may include surgery, radiation therapy, chemotherapy, or a combination. Human papillomavirus (HPV) infection is the most significant risk factor, although smoking, a weakened immune system, and long-term use of birth control pills also increase the risk. Here's a look into the detailed aspects of cervical cancer, laying out the journey from diagnosis to management. Symptoms and progression of cervical cancer. Cervical cancer often remains asymptomatic in its early stages, which is why regular screening is critical for early detection. As the disease progresses, symptoms may become noticeable. These can include abnormal bleeding, such as postcoital bleeding, unusual vaginal discharge that may have a foul odor, or bleeding after menopause. Pelvic pain and discomfort during intercourse are also common indicators. The cancer's progression can lead to more severe symptoms like kidney failure, leg pain or swelling, and severe back pain, as tumors impact adjacent tissues and organs. Without timely intervention, cervical cancer can metastasize to distant organs, significantly complicating treatment and reducing the likelihood of a positive prognosis. Diagnosis of cervical cancer. Early diagnosis of cervical cancer significantly increases the chances of successful treatment. Typically, cervical cancer is diagnosed through a pap smear, which identifies precancerous or cancerous cells on the cervix. If abnormal cells are found, a clinician may follow up with an HPV DNA test, since human papillomavirus (HPV) infections are closely linked to cervical cancer. Additionally, a colposcopy may be recommended, whereby the doctor examines the cervix more closely, often taking a biopsy for further analysis. When detected early, cervical cancer is one of the most successfully treatable forms of cancer, emphasizing the importance of regular screening for women, especially since early-stage cervical cancer may not present with any symptoms. Cause and risk factor of cervical cancer. Cervical cancer primarily stems from a persistent infection by certain strains of the human papillomavirus (HPV). High-risk HPV strains such as types 16 and 18 are responsible for most cases, triggering cellular changes in the cervix that can progress to cancer. Risk factors amplifying the likelihood of developing cervical cancer include a weakened immune system, smoking, long-term use of oral contraceptives, and having multiple sexual partners, which raises the chances of HPV infection. Additionally, lack of access to HPV vaccination and screening for cervical dysplasia, which are precancerous conditions of the cervix, increases the risk of cervical cancer. Early sexual activity and giving birth at a young age are also contributors. Therefore, preventive measures such as HPV vaccination, regular pap tests, and practicing safe sex are crucial in reducing cervical cancer incidence. Treatment and management of cervical cancer. Effective treatment protocols for cervical cancer hinge on early detection. In its early stages, options often involve surgical methods such as cone biopsies, loop electrosurgical excision procedures, LEEP, or hysterectomy, delivering promising prognoses. Advanced stages might require a combination of radiotherapy and chemotherapy, with cisplatin-based regimens being commonplace. Innovative treatments like targeted therapy and immunotherapy are also emerging, aiming to exploit the cancer's specific molecular characteristics and bolster the patient's immune response. The HPV vaccine stands as a critical preventive measure. Personalized medicine, considering factors like genetics and lifestyle, is tailoring treatment plans, enhancing outcomes and quality of life for patients. Managing potential side effects and providing psychological support are crucial for a holistic treatment approach.